Sit. Today is the 36th anniversary of the Cathedral Medical Society, and it is part of our tradition that when it is the anniversary of this society, we have our annual health talk. And today we have invited an erudite scholar to guide us, to contribute to our hygiene in person of Professor Mrs. Ranti daCosta. You're welcome. Well, I won't talk more about her, but later I will give you a tip into the personality who is addressing us today. Prof, over to you.
Thank you so much, sir. Good morning, everybody. Brothers and sisters, mommies and daddies, God bless you all. Welcome to the cathedral. Today, I want to give you just a brief discussion about your oral health. And I'm going to start by asking questions. Can I ask the media to please start with the slides? Thank you. So my question is to anybody in the house. Who has been to the dentist in the past 1 year? In the past 1 year. Okay. Can somebody tell me why they went to the dentist? Those of you that have been to the dentist in the past 1 year, why did you go? Yes, ma'am. Scaling and polishing, cleaning, very common reason for people to go, people that are conscious of their health. But in this part of the world, the most common reason for people going to the dentist is actually because of pain. That is what drives the majority of patients to the dentist. And that is not how it should be. Next slide, please. So, what is oral health? Your oral health refers to your teeth, your gums, your tongue, the roof of your mouth, the floor of your mouth, the whole system that allows you to smile, to speak, and to chew. Next slide, please. And you should know that your oral health is actually connected directly to your general health. They say the mouth is the window to the rest of your body. So if something is going wrong in your mouth, it is possibly an indication that something is wrong with the rest of your body. Take, for example, patients that are diabetics, and especially uncontrolled diabetics. We find out that they are far more prone to gum disease than the normal, healthy individual. If you have a bleeding disorder and you have healthy gums, but yet you're bleeding, then it might be a sign that you need to see, to smile, to eat, and also to taste and enjoy what you are eating. It affects the quality of life on a daily basis. Next slide, please. Now, we'll talk to you briefly about the different stages of dentition because we have different ages in the church. Your first tooth, the first tooth tends to come out around 6 to 9 months. And by 3 years, the whole of your baby teeth are in. Those are usually referred to as your milk teeth, or to those of us in the profession, the primary dentition. And that consists of 20 teeth going from front to back. Back, please. And then you have, from 12 to adulthood, you have what we call the permanent dentition, where all the baby teeth have dropped out, and you have the adult teeth that are supposed to stay with you for the rest of your life. And so a common fallacy is that by the time you're getting older, it is normal for you to lose your teeth. It is normal for your teeth to start shaking. Now, of course, this is actually not true. If you maintain your oral health very well, your teeth should last you a lifetime, even if you die at the age of 104. Between the primary dentition and the permanent dentition, we have what we call the mixed dentition. I have a lot of parents coming in with their children at the age of 9 saying, oh, do they still have baby teeth? Yes, most children do have baby teeth up until the age of about 11 or 12. So by the time they get to 12, they should have shed all their baby teeth and they should have a full set of permanent teeth. So this stage of dentition is referred to by the dentist as the mixed dentition stage. Next slide, please. So how do you maintain your oral hygiene? Maintaining your oral hygiene is very key to having that brilliant smile and maintaining healthy teeth. You brush your teeth twice a day. Hard work, but highly advisable. You floss once a day, and floss comes in different forms. It comes in lengths of string, it comes in tapes, and now it comes in little handles that have just a short 1 or 2 inches of floss in between. That makes it much easier for us to manage. And you use a medium to soft toothbrush. So, believe you me, there's nothing to be gained by using the wonderful smoker's toothbrushes that I know some people will scour the market to see if they can get. Smoker's toothbrushes are very hard. They can damage the teeth. They can damage the gums. So you don't want to use those in your daily hygiene practice. And you want to change your toothbrush around every 3 months, or depending on the quality of the toothbrush you're using, once the bristles of the toothbrush start looking scattered. The use of chewing sticks is fine. No problem at all with chewing sticks, so long as you use them appropriately. That means you chew them, and then you use the bristles that you have chewed to actually clean your teeth. A lot of people just chew the chewing stick and throw it away. That's not how, and spit it out. That's not how it works. If you make the bristles and use the bristles to clean your teeth, the chewing stick is a very adequate means of keeping the teeth clean. And it has the added benefit, as a lot of chewing sticks, especially in this part of the world, actually have a fluoride content. And fluoride, of course, is good for your teeth. So, looking at the slides on the screen, you have a nice new cross-action toothbrush looking good at the beginning. And then, of course, you can use your electric toothbrush if you have a preference. But there's no additional benefit to using a toothbrush unless you have manual deficiencies. If you use your regular toothbrush well, you can get as good a result as what you can get if you use a electric toothbrush. Then you have your floss, and of course, time to bin it when your toothbrush starts moving, when the bristles of your toothbrush start moving in all different directions. Next slide, please. Please use a fluoride toothpaste. Fluoride helps to protect your teeth. It strengthens your teeth. It actually combines with the components of the tooth and makes the tooth stronger and helps to resist cavity formation. So you've got fluoride in McLean's, you've got it in Close-Up, Colgate, Aquafresh, Oral-B. And if you're not sure what is going on with the toothpaste that you're using, simply turn to the reverse and look and see what the content of your toothbrush is. Now, we know that it's very popular for us to use a long length of toothpaste that extends from the beginning of the bristles of the brush to the end. No longer necessary. And this should be good news in this era where we're trying to save, where we're trying to economize. A small pea-sized amount of toothpaste is actually adequate to brush your teeth properly. Next slide, please. So what happens when you fail to maintain oral hygiene? Well, what you get is debris collection. It's usually soft, and it contains food particles, it contains different kinds of debris, it contains bacteria. But the good thing about plaque is that it's soft, and it normally forms within 24 hours of failing to brush your teeth or failing to brush your teeth adequately, whereby you may find some areas are clean, but some areas still have plaque. Now, if you fail to clean that area, if you fail to use your brush to suitably remove that plaque, then it hardens, it calcifies. And once it calcifies, it forms what we call calculus, what the layman often refers to as tartar. And tartar starts off as cream, can move on to a dark yellow, and if you leave it there for long enough, it can actually turn to a dark green. Tartar means that you need to go and see your dentist. That is something that your brush is not going to take off. So attack your teeth when we're at plaque level, and you can get them out satisfactorily without using any instrumentation. However, we still do recommend regular scaling and polishing every 6 months. So, there are different methods of brushing the teeth. And I'm not going to say one method is wrong and another method is right. I am personally averse to the scrubbing mechanism, where you just scrub from side to side. I prefer up and down, because up and down allows you to hit the gums. And we find out that a lot of time, this is where many patients go wrong. They scrub from side to side, they don't get the gum area, and that is the area that is most important to ensure that you clean, because if you fail to clean it, then the bacteria that is in the plaque is going to irritate the gums. And I'm sure there's nobody here that hasn't experienced some bleeding of the gum. Flossing is advised, and I've talked about the different types of floss there are. You do this once a day, and this is used to clean out the areas in between the teeth. So those are the contact points. You can't get much through it, but you can get a piece of floss through it. So you will find out that if you clean these are areas that the toothbrush cannot reach. So if you floss once a day, you will find out that you will continue to maintain very good oral hygiene. And sometimes you'll find, even though you've brushed, somebody might complain that your mouth is not smelling quite as maybe your significant other. You know, you zoom in for a kiss and it's like, okay. So we're going to go back and check ourselves. So flossing at night is easier because you tend to have more time. You're doing it just before you go to bed. You tend to have more time than in the morning when you're probably rushing to go to work. And of course, don't forget to brush your tongue. Your tongue can be brushed using the brush itself, if you're using a medium toothbrush. They also have some small bristles. Some of the more superior toothbrushes have small bristles on the handles that you can actually use to brush your teeth. So check your toothbrush when you get home. You might find that's useful. And then, of course, they also sell separate tongue scrapers. Next slide, please. Now, just going briefly through the anatomy of the tooth. The tooth has 3 layers. The outermost layer is called the enamel. And the enamel is the hardest substance in the body. It's harder than bone. And it's innervated. It's de-innervated. So there are no nerves in it. So it's not sensitive at all. The next layer, which is yellowish, is the dentine. And the dentine is innovated. You'll understand why I'm giving you this lecture before I start talking about the problems that come in. And right in the middle, we have what we call the pulp. The pulp is full of blood vessels and nerve endings, and that is highly sensitive. Okay, for the women, I have had patients come in and telling me that the pain is worse than the pain of childbirth. And we all know that childbirth, there's contractions, so you get some reprieve. When you have a bad toothache, there's no reprieve. It just goes on and goes on. Okay, common dental diseases. Dental caries is actually the most common disease worldwide. Sounds weird? It's actually less common in this part of the world than it is in the more developed countries. However, there is a trend in our environment where the occurrence of dental caries or tooth decay is increasing, whereas it's decreasing in other parts of the world. So this is something that we need to check. Our children are being exposed to all kinds of things. Biscuits, sweets, soft drinks, all the things that they're trying to discourage and educate. In the more developed countries, our children are finding ourselves victims to this exposure. And so that's something that parents with young children need to look into. Then, of course, in the older age groups, we have what we call periodontal disease or gum disease. And gum disease occurs most frequently because of failure to maintain good oral hygiene. And it might start very mildly, little inflammation of your gums, slight bleeding, you ignore it, the debris continues to build up, plaque turns to calculus, irritation, your gums have had enough, and they begin to run. And suddenly you find out that your teeth are getting longer and longer, your gums are getting less and less. These are your supporting tissues. So the minute you start losing your supporting tissues, your teeth will start to shake. And there are different stages. But one thing you can't do is especially if the bone is lost, the gums go, the bones go, the ligaments supporting the teeth go, and your tooth starts shaking. They don't come back. So you want to stop it in its very beginning. Okay? Right from gum disease. Gum disease is reversible. Periodontal disease, which means that it's affected the ligaments, the bone, that is not reversible. And then we have tooth sensitivity. There are many factors that cause tooth sensitivity, and we'll talk about that later. And then we have my area, what we call malocclusion, or poor alignment of teeth. So we're going to start, next slide please. We're going to start with cavity formation. A lot of time when patients come to me and they tell me their teeth are really, really aching, they couldn't sleep, I say, He said, oh, when did this start? They said, 3 days ago. I said, no. This tooth sent out warning signals. You didn't listen. So, when cavity formation begins, it begins in the enamel. And remember what I told you about the enamel? There are no nerves in the enamel. So it's not sensitive at all. So you will have that decay in the enamel, you won't even notice. You won't have any pain. All you will have is probably symptoms. You might have a white mark, it might turn light brown, dark brown, even black. But if it's still in the enamel, you're not going to have any pain. And there's always a tendency for you to ignore it. Now, Once it goes beyond the enamel, it goes into the dentine. The dentine is sensitive. And so that is when you will start feeling the effect of this cavitation. You may find out that when you take hot foods or cold foods or sweet foods or drinks, that you have pain. But once you don't take them, you're fine. And so what a lot of people do is they just switch to the other side of their mouth and manage that. And the cavitation continues. Those that are more aware, dentally aware, will know that something is going on and they need attention. But fortunately or unfortunately, we're in an era where we don't have nearly enough dentists to attend to the population of 200 plus million that we have in Nigeria. And so the awareness is limited in many areas. I want to believe that the environment that I'm in right now, we deal with people that we're dealing with those that are probably more aware than many, many others. Now, by the time it goes to past the dentine, it goes into the pulp, and the pulp gets inflamed. Now, by the time it gets into the pulp, that's when the real pain starts. And this pain is going to be very nice. It's going to wake you up at 3 a.m. and you are not going to go back to sleep again. And even then, even with this pain, if you manage to get past it, this is when people go out, they start chewing Panadol, they take battery acid and pour it on the tooth. They try all kinds of touch and go. I have no idea why it's still in the market. It shouldn't be. All these items are used in an attempt to stem the pain. Some people will even go to the local babalawo. I remember my own uncle, my mother's brother. I had been a dentist for 10 years. He went to the local babalawo and came and he showed me. He said, "Ranti, see, they brought out all these maggots from my tooth." I said, "Uncle, it's okay. I'm waiting for you. Sure, you know where I am. There's no problem." Of course, he ended up coming back. Now, if you manage to pass pulpitis and get to periodontitis, you get to periodontitis, where you have inflamed, the tooth is now infected. Not inflamed, but infected. And that is the time that some patients may present with abscesses. They come with swellings. It might be swelling of the gum. It might have extended. There might be edema of the face. Okay. So when patients come and they complain that, "Oh, you know, this swelling happened 3 days ago." I said, "This tooth tapped you. You ignored it. It slapped you. You ignored it. It punched you. You fell down, you got up, and you went your merry way. Now, it has turned you into a boxing weapon, where it's just hitting you left, right, center." So, take the message when it comes. The minute you get the tap, go and see your dentist. Don't wait until you're being boxed. Now, what are the causes of tooth decay? I think most people will know that. A combination of poor oral hygiene, failure to keep your teeth clean, and the consumption of sugars. Foods and drinks that are rich in sugars. And I'm going to add to that combination the issue of time. Because if you take a drink, if you take ice cream, if you take a sweet drink, or you take biscuits, and you remove it from your mouth, you go away, you brush, you come back, then time is eliminated. that sugar has to sit in the mouth long enough for the bacteria that is present in the plaque to act on it. Now, once it acts on it, it turns those sugars into acids. And those acids are now what work on the teeth and gradually dissolve the teeth. So as hard as what enamel is, acid can do the damage, okay? And acid doesn't only come from sugars, but that's a story for another day. So chocolates, soft drinks, if you're somebody that cannot resist the chocolates, cannot resist the biscuits, cannot resist the sugars, and there are many of us, including myself. I have been a dental patient since I was 5. That is why I am where I am. So once you know that you cannot resist these things, be ready to have a great relationship with your toothbrush and your toothpaste. So basically, we've taken you, next slide please. So basically, we have taken you through all of the problems when it comes to tooth decay. Keep in mind that there's no surface of the tooth that cannot cavitate. It can be right in the front of your front tooth. It can cavitate. Right at the back. In between teeth. And that's why we say floss. In between teeth is what we call interproximal caries. In between teeth, it can decay. Now, saliva, if you're somebody that salivates a lot, it actually acts as a very good repair system. Okay, so sometimes just chewing sugar-free gum helps. So what are the signs and symptoms? Tooth discoloration, then cavitation, the sensitivity, pain on chewing, spontaneous pain by the time it gets to the pulp, and then finally, when we have periodontitis, we have the swelling. So, going on to gum disease. We've already said that gum disease is usually caused by poor oral hygiene. And it starts with swollen and puffy gums. In the picture, next slide please. In the next slide. So what you're seeing at the top is actually what we call acute gingivitis. It hasn't happened gradually. It's possible that this person, for whatever reason, did not brush for a very long time. So it wasn't somebody that wasn't doing a great job. This is somebody that wasn't doing the job at all. So you start with the puffy gums. It goes on to bleeding. Gradually, you find out that the gum runs away from the teeth in a bid to run away from the debris that is on the gum. But I always tell people, if you find that you are bleeding on brushing, please don't stop. That is something that especially my kids like to do. And when I say my kids, I'm talking about my child patients. Oh, it was bleeding, so I haven't gone there. You're making the situation worse. When you bleed on brushing, that is the area you want to concentrate on, so that you can get rid of the debris before that plaque turns to calculus. And that way you will not be able to remove it using the brush. Then, of course, you get the bad breath. And that now progresses to periodontitis, or mobile teeth. Now, tooth sensitivity. I find that, especially as you get a little older, you find that your teeth may become sensitive. And it can occur as a result of worn enamel, cracked teeth, exposed roots, that is, your gum has actually moved far away from the teeth, or a worn filling. So you can have a filling that has worn down to the extent that it's actually exposing dentine. And as I said before, the dentine is actually sensitive. So you find that you take something hot or cold, and it can even be, oh, you opened your mouth. You get that sharp burst of pain. And there are many things that can cause tooth sensitivity. And one of them is excessive brushing. And excessive brushing can often cause the loss of enamel, the wear of enamel, especially around the necks of teeth. And around the necks of teeth, once the dentine is exposed, you get that sensitivity. It can also occur when you post-bleaching. Hydrogen peroxide is one of the items that they use in bleaching, and it can cause temporary tooth sensitivity. Another way of exposing yourself to tooth sensitivity and acids is the use of healthy living, should I say. And we're talking about things like lemon water in the mornings. Okay? Healthy. Many women like to do it. I don't know about men, but I know that many women like to take the lemon water. They also like to take juices and smoothies. Smoothies are acidic. Juices are acidic. They're healthy, but they have a way of causing what we call erosion of the surfaces of the teeth. So once you lose that top layer, that is your enamel, you're exposing your teeth to the elements and causing sensitivity. Then just briefly, we'll talk about oral cancers, mainly because it's very easy to ignore them. Where can you find oral cancers? Almost anywhere. In the mouth, the lips, the tongue, the palate, the roof of the mouth, the gums, the cheeks, or the floor of the mouth. Oral cancers can occur anywhere. And what factors can play a role in it? The use of alcohol, heavy alcohol, use of tobacco, the human papilloma virus, betel nut chewing, and sometimes it runs in families. So it's a genetic predisposition to the cancers. Now, what are the signs and symptoms? I think that's what makes it so scary, in that it's very easy to ignore. You may find out that you just have a red patch in your mouth. It may not even be painful. Or you have a white patch in your mouth. It may not be painful. But it's not going away. You have a lump. It's not painful. You're ignoring it. It wasn't there before, but it's not disturbing you. Then you might find you have a sore, an ulcer, crops up on your tongue. You ignore it. It's there 1 week. It's there 2 weeks. Then you need to give it some attention, okay? Because you might have thought you bit your tongue, but if it's still there after 2 weeks, you want to go and have it checked. So, prevention, what have I said? Brush twice a day. Next slide, please. Floss at least once a day. Next slide, please. Thank you. Choose a fluoride toothpaste. You can use a fluoride mouthwash. Or, in some areas, they actually have fluoride in the water, in the natural water. In Plateau State, they have fluoride in the water, not in Lagos, as far as we know. Eat healthy meals. That basically, you want to limit the amount of sugars. And if you can't resist, please brush. And then maintain your regular dentist. Maintain your regular checkups. You want to see your dentist twice a year for checkups and for cleaning of your teeth. Don't delay the necessary treatments, and we've said it. When you're being tapped, heed the warning. Don't wait until you're being boxed. Okay, what are the treatment options? Very quickly. Fillings. If you have decay, you want to hope that it won't go beyond having to do a filling. Next slide, please. You want to hope that you don't have to go beyond doing fillings. And there are different treatment options in terms of filling. You have amalgam, which is being phased out in most countries, and they're trying to phase it out in Nigeria as well. You have composite. Amalgam is the silver-colored filling on the far right. Composite is the tooth-colored filling in the middle, and glass ionomer cement as well. They are both tooth-colored. And while you have the great advantage of the fact that they are the same color as the tooth, so the teeth don't look so ugly, they are not nearly as effective a filling material as the amalgam, which is being phased out. Now, by the time your decay reaches the pulp, that is where the blood and nerve vessels are, you can't just fill, you have to undergo root canal treatment. And this root canal treatment, this is something that my husband loves to do. I run away from it. Involves the removal of all the pulp tissue. So you're removing the nerves and the blood vessels of the tooth. So at the end of it, the tooth is technically dead, but it is still functional because you're using the tooth to maintain space. You're using the tooth for aesthetics. You're using the tooth to chew. So it's still functional. However, once you have had root canal treatment, you must crown that tooth. That means you must cap that tooth. If you fail to cap the tooth, then the tooth gradually over time becomes brittle, and there's every likelihood that at some point it will break. Next slide, please. Now, if you do lose the tooth, there are different options. The first option, and probably the cheapest option, is just to use a partial denture. These are made out of acrylic, which is a plastic material. And you take it out at night, you put it in a glass of water, you put it back in your mouth in the morning. Most people don't like using partial dentures. However, the other options are a little more costly. So you have the bridge. The bridge involves trimming down a tooth on either side and replacing the missing tooth. Yeah? Okay. Okay, and then you have the implant. And that's what people who know what's good for them go for, in which we drill into the bone and we crown what that bony, that metal component, we now crown it with a crown. Scaling and polishing twice a year, more if required, and it should be carried out by the dentist or the dental hygienist. You can see the difference. Now, for treatment of sensitivity, if you're a health nut, use a straw to avoid, for your smoothies, for your acidic drinks. Use a soft brush, bristled brush. Use desensitizing toothpastes and varnishes. And if all else fails, like if you have a crack, you may need to do root canal. 2 more slides ahead. Now, if you have poor alignment, it's very common, actually. More than 80% of the population has a tooth, at least one tooth that is out of place. But this can be sorted out in different manners. We have regular braces, tooth-colored braces, and we now have aligners. I think I have managed to keep up. Thank you very much. So just keep in mind that a beautiful smile makes it all worthwhile. Thank you.
Thank you, Prof.